what is this Dermaroller?
The Dermaroller is looks and feels like a medieval instrument of torture, as phrased by another journalist. It uses and it harnesses the skin's own ability to regenerate and heal itself. Whether we look at peels or whether we look at laser resurfacing such as Fraxel and Pixel, the one key denominator about them all is that they're actually traumatizing the skin and causing the release of growth factors that reinstigate the synthesis of new skin, new collagen and new blood supply. The Dermaroller is one mechanism by which we can do that, that uses microneedles. The key with the Dermaroller is that it doesn't actually sacrifice any skin tissue. You're not losing a layer of the epidermis. We're not boring holes as one would do with a laser. So because there is no sacrifice of skin tissue, the downtime is only a fraction of a medium depth peel. And the side effect profile as a result is a lot better.
Hi, I'm Kate, I'm 49, and I've just started to think about things to do with my skin, like the radiance and how it looks, and thinking about what I can do to improve it. I've got a few fine lines around the eyes. I've got some lines on my forehead which I disguise with a fringe, and I'm not somebody who is interested or wanting to go down the road of injections or anything like that. I'm a bit sort of like, but I really feel that my skin could do with an all-over comprehensive bit of sort of treatments. That I know something like Dermaroller is something I've looked at, and I feel that it would just give me some radiance that I probably won't get if I just leave my skin to its natural sort of downward hill struggle. So I thought a bit of oomph, and hopefully that's what Dermaroller will give me. I've had anaesthetic cream applied to my face now for an hour, and it's completely numb, so I'm just looking forward to having the treatment.
I'm going to do a quick test roll.
Yeah.
How does that feel?
Fine.
Okay. So what I'm intending to do here is achieve a clinical endpoint. So for me, I know that I've rolled an area well if I achieve 2 out of 3. Number 1, mild pinpoint bleeding. Number 2, slight redness and erythema within the skin. And number 3, some swelling. Microneedling therapy actually derived 15-20 years ago, when surgical scars that had lost colour were being treated with medical tattooing to help blend in the scars with the adjacent area. But when they tattooed the areas and patients were called back, they were finding that the tattooed region, the scar appearance, actually was being improved. So they then experimented by dry tattooing. That's tattooing without using any ink whatsoever. And then through a process of evolution, it progressed onto a stamp, and then eventually onto the roller. The Dermaroller itself is very, very popular amongst my celebrity clients. Historically, the downtime involved with peels meant they would need to take quite a significant amount of downtime and time off. Now they're able to have a treatment. The downtime associated with this procedure is no more than a couple of days. Because the skin is relatively sore for a couple of days, your aftercare generally involves the use of just water to wash the face for 2 days whilst the skin is still red, and to use just a basic emollient. If leaving the house, I'd recommend an SPF of 50, but clients are free to put makeup on after about 24 hours. I often get asked how long results will last. At the end of the day, I'm not able to stop the aging process, but the collagen that does get stimulated, the new skin that does get stimulated, is your own. So I do expect results to last a few years. But there's nothing there stopping you to have top-up treatments done once or twice a year, should you so wish. Okay, well, one of the questions I get asked a lot during consultation is, Doctor, I've seen various dermarollers on the internet. What makes this one different? There are lots of other dermarollers on the internet, but this is the genuine one. This is the only one which is CE marked as a medical device. And it's the only one which is exclusively only provided to trained practitioners that are clinically qualified. So how does that feel?
Well, because you've had the anaesthetic cream on, it's sort of been, before it was quite numbing, but now there's this really lovely hot sensation in your face, so it just feels really warm and nice.
So what I'm applying now is a recovery cream and mask that will help soothe the skin a little bit more. Open your eyes for me. Thank you.
Well, I found it a really straightforward procedure. You know, it was quick and doesn't really hurt or anything, so it's great.